The emergence of new COVID-19 cases in Qingdao has raised public concerns about a potential second wave in China, just as the flu season also approaches. Earlier, we spoke to Professor Wu Zhiwei. He's the director of Center for Public Health Research under Nanjing University Medical School. We asked him about the risks.
There is a possibility. As far as we knew right now, the virus is highly resilient and very infectious. Basically, what we saw in Europe, in America, is that if you implement strict public health measures, provide quarantine and also social distancing, wearing the face mask, the virus will go down. But if you lose it up and the people start coming out, basically what you see is that they will come back. So I think as our life in China coming back to normal, what happens is that the people may have increasing contact, and you will see that in some public areas, restaurants, you see a lot of people gathered inside. I think this will definitely increase the possibility of the viral resurgence. So this is something actually we have to bear in mind, that we don't have vaccine yet, we don't have therapeutic drugs yet. We really have to take precaution, doing all sorts of available public health measures to contain the virus. The regular flu is coming very soon. This will a complicated situation because the flu flu shows very similar symptoms clinically. So this actually would be a huge challenge for controlling the COVID-19 infection. I think we have to use common sense. We have to use all the experience built up over the COVID-19 outbreak, that maintain social distancing and avoid unnecessary gathering, and also particularly in large venues with a lot of people, that I would advise people, if it's not necessary, just avoid it. The other thing is that wearing the face mask and identify the infections at the early stage. I think self-discipline is very critical in terms of this particular period.